The one single question every IVF patient should ask their IVF clinic before actually signing up for an IVF cycle. I'm Dr. Malpani, and if you want to find out what that question is, and if you want to find out what the right answer to that question is, please watch the video. I run an IVF clinic at www.drmalpani.com, and one of the things we take pride in is educating patients so they understand what is involved in an IVF cycle, what affects the success rates, what they can do to increase their chances, what they need to do in order to be able to talk intelligently to their doctor, what questions they need to ask the doctor, both before the IVF cycle, during the IVF cycle, and after the IVF cycle. We try to demystify IVF. We try to strip it of all the jargon. Unfortunately, a lot of IVF doctors make IVF to be a very complicated piece of treatment. Now, I'm not saying you should do the IVF for yourself, and IVF does require a skill set, and embryologists are extremely skilled, but that doesn't mean that it's so complicated that patients can't understand what's happening. Now, there's a long list of questions you could ask your doctor, and some of them are pretty common, like how many years experience do you have, how long have you been doing this, what's your expertise, what's your success rate, generic questions. But the problem is it's very hard to find the full answer to these questions, because every doctor will give you exactly the same answer. The biggest problem is they will lie, and there's no way you can find out whether they're lying or not. And standard answers, no, we have the highest success rate in the world, our pregnancy rates are more than 80%, we're the best IVF clinic, look at all our newspaper photographs, look at all the celebrities we've got pregnant, of course we're the right ones, and you need to come to us. Now, the problem is all these doctors are in sell mode. They're selling all the time. They're trying to convince you why you should do an IVF cycle with them. And the tragedy is, once you've signed up and once you've given them the money, they sing a completely different tune. You then will not see the brand name doctor anymore. It'll always be a junior. There are main doctors too busy or too bothered. Or the reality is, he's so busy selling to new patients and doing consultations with new patients to catch more bakaras, but he doesn't have any time for the old patients anymore. And this is true not only during the IVF cycle, which is then very late because they're not going to give you your money back even if you're unhappy. This is much truer after the IVF cycle has failed, because then the doctor just disappears. They're not interested in answering your questions. They're not willing to give you any answers. You get all kinds of vague replies. Oh, it's your naseeb, it's kismat, we did everything possible. Maybe it's your eggs which are bad, maybe it's your sperm which are bad, maybe you need to use donor eggs, all kinds of rubbish. And patients get increasingly frustrated and angry. We spend all this money and this guy doesn't even have time to talk to us properly. They routinely make you wait for 2 hours and 3 hours, and then sorry, the doctor's busy, he's in the operation theater, he's in an emergency, he's flying, he's got all kinds of rubbish. And that's why the only way to protect yourself is to ask a question to which the doctor is forced to tell you the truth and he cannot lie. And this simple question is, do you give photographs of your blastocysts to all the patients when you do the embryo transfer? Now let me break this up to you because it sounds like a complex sentence with lots of jargon, but it's actually very basic, and this is something which all IVF clinics do routinely all the time. They always give photographs of embryos to all their patients. This is important documentation and it's done routinely. It's important for the clinic because they can see whether they're producing good quality embryos or not. And it's important for the patient because the patient can see that the doctor has done a good job medically and made good quality embryos. And this is information they can share when they're getting a second opinion, talking to another family member, going to another IVF clinic. So that is not negotiable. And any doctor who tells you, I'm sorry, the camera wasn't working, or we don't give photos routinely, or taking photos damages the embryos, is a liar. He's not telling you the truth. Red flag, stay away from these clinics and doctors, because obviously they have something to hide. And if the doctor tells you he gives embryo photos routinely, it's very easy to check. Talk to other patients who are waiting in the consulting room who've done cycles before. Talk to the nurses. And if the nurse looks blank, photos? What photos? Embryo photos? I don't know what embryo photos are. Obviously that tells you that this doctor is lying to you. And that's true for patients as well. Every patient file should have embryo photos, and if those photos are missing, that means this doctor is not doing a good job. Now, we don't give you photos because we expect you to become an embryologist and we expect you to be able to grade your embryos. We give you photos for the sake of openness and transparency, to show you that we are doing a good job and we're documenting it. Every IVF clinic will do it. So they provide photos routinely, proactively, whether patients ask for it, don't ask for it. and these are blastocysts they're transferring. What does that mean? That means that an embryo is transferred on day 5. This is a top quality embryo, and the reason we wait to day 5 is because now it has 100 cells, so it's very easy to pick and choose which the best embryo is. And this is what all clinics do routinely. And this is the simple question, the single question you need to ask. Not very difficult to ask the question. And if you're not getting a straightforward answer, something's wrong, trust me. You want to find out more, please go to our website. It's at www.drmalpani.com. And if you have more questions, please send me an email. You can fill up a free second opinion form on our website, and I'll reply back to you in 24 hours. I will look forward to helping you to have a baby. See you at www.drmalpani.com.